Hello everybody, welcome to Adexee TV. My name is Adexee Tv. I'm back on another medical series for you guys. If you've not watched my last video about hypertension, you should go watch it. And under the comment section, someone asked me to do a video about diabetes, hence this video. So in this video, we're going to be talking about diabetes. That's the topic of today. It can also be called diabetes mellitus. First of all, what is diabetes? Diabetes is the disorder of metabolism, or the increase of blood glucose in the body over a prolonged period of time. Most of the food we eat is burned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near to the stomach, makes the hormone called insulin to help glucose get into cells of our body. When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should. It causes sugar to build up in your body, and this is why many people refer to diabetes as sugar. You need to know that there are three types of diabetes, being type 1, previously called insulin-dependent diabetes mellitus, and type 2, and gestational diabetes. So what is type 1 diabetes? It's an autoimmune disease in which the immune system attacks and destroys the insulin-producing cells. And in this type of diabetes, you need insulin to live. Or juvenile onset diabetes. Type 1 diabetes may account for 5% or 10% of all diagnosed cause of diabetes. Risk factors are less defined for type 1 diabetes than the type 2 diabetes, but autoimmune, genetic, and environmental factors are involved in the development of this type of diabetes. It's mostly common in kids and young adults. So that's for type 1 diabetes. So let's talk about type 2 diabetes, which is NIDDM, or adult onset diabetes. It's when the pancreas doesn't produce enough insulin for the body, or the cells doesn't respond well to the insulin produced. You need to know that type 2 diabetes is usually associated with older age, obesity, family history, prior history of gestational diabetes, impaired glucose tolerance, physical inactivity, and race, which is African American, Hispanic / Latino Americans, American Indians, and some Asian Americans. And Pacific Islanders are at partially high risk of type 2 diabetes. The causes are usually multifractional, and more than one diabetes cause is involved. And physical inactivity, which causes slow healing wounds. Type 2 diabetes may account for about 90% to 95%. So let's talk about the gestational diabetes. From gestational, you should know that it's about pregnancy, right? So it occurs in late pregnancies but disappears after delivery. And you are prone to have type 2 diabetes later in the future, like from 5 to 10 years. So if you already have gestational diabetes, you should watch the way you eat, so you should know to avoid diabetes in the future. Other specific types of diabetes result from specific genetic syndromes, surgery, drugs, malnutrition, infection, and other illnesses. So what are the symptoms of diabetes? These are the symptoms. You have polyuria, which is increase in urine, polydipsia, increase in thirst, polyphagia, that means increase in hunger, then weight loss, tiredness, very dry skin, sores, more infection than usual, sometimes nausea, vomiting, or stomach pain, and blood vision. How to manage diabetes? First of all, you have to exercise regularly, physical activity, then followed by diet. If you have to eat healthy with less sugar, obviously, then you have to keep tabs or keep notice of your blood pressure, your blood sugar, and your cholesterol, right? So let's go to the medication. Obviously, we need insulin, right? Diet control, exercises, home blood glucose testing, oral medication, or insulin. What are the complications of diabetes? We have the acute and we have chronic. Under acute, we have diabetic ketoacidosis, which means life-threatening diabetic coma. That's diabetic ketoacidosis. You have hyperglycemic state, there's death, there's hyperosmolar, right? And for the chronic complications, we have cardiovascular disease, we have stroke, we have amputation, there's damage to the eye, which is blindness, and foot ulcers. So that's everything about diabetes: the definition, the types, the complications, and the treatments, also the medication. So enough of hyperglycemia, which means diabetes, of course. Hyper means high, glycemia means sugar. So what if you have low blood sugar, which is hypoglycemia? You would find that the person is nervous, confused, and mostly shaking, right? And if it gets lower than that, that's where you see some patients fainting from having low blood sugar. The death rates of blacks with diabetes are 25% higher than of whites. There is no cure for diabetes, but it can go into remission, and people can manage it with medications and lifestyle changes. What food can reverse diabetes? Desserts, sweets, pastries, bread, chips, crackers, and pastas. Beans, dairy, tuna, fish, salmon, barley, oats, berries, grains, walnuts, dark chocolate, and peanut butter. So that's the end of this video, guys. I hope you enjoyed this video. Make sure you click on the like button, subscribe if you've not. If you have, thank you so much for subscribing. Make sure you click on the notification button beside the subscribe button so you get notified anytime I post any video. And more medical videos are coming up soon. Watch out and stay blessed.